Autism, serotonin. Is there a connection? Have you heard of serotonin? I will be talking about abnormal levels of serotonin and how and if they affect the expression of autism on people, and what happens if you have high levels of serotonin floating in your bloodstream and in your gastrointestinal tract, and what happens if you have low amounts of serotonin making it to your brain. Welcome. So, abnormal levels of serotonin have been found in blood and the brains of individuals with autism. Some research suggests that it may be the way serotonin is metabolized and regulated in the mind of those of us who have autism and neurodiverse conditions. These changes could potentially affect the development of brain circuitry and also your moods and your physical health. So serotonin is a neurotransmitter that plays a role in regulating mood, appetite, and digestion. This is it's produced in the brain and also in the gastrointestinal tract, where it acts as a signaling molecule to regulate various functions. So in the brain, serotonin acts as a neurotransmitter, transmitting signals from one nerve cell to another. It involves regulating mood, appetite, and sleep, and is thought to play a role when low in depression and also anxiety when it's not properly metabolized. In the gastrointestinal tract, serotonin acts as what's called a vasoconstrictor. So it constricts the blood vessels, not allowing excess blood to flow into your gut area. And it regulates blood flow and also the ability for your gut to move food through from your stomach all the way to your colon and absorb it properly and give your body time to absorb it properly. Not too slow, not too fast, the Goldilocks time period in which you get maximum absorption of your nutrients from your food. If it's going too quick, you're going to get diarrhea. If it's going through too slow, you're going to get constipation. So it's one of the regulating neurochemicals that's from your brain down into your gut and telling your gut how to work properly. So so people with elevated amounts of serotonin in their gut can lead to such symptoms as abdominal cramping, diarrhea, and nausea. Low levels have been linked to conditions such as irritable bowel. So elevated blood levels of serotonin are a biomarker for over 25% of children and probably adults as well with autism. The serotonin system has a role in multiple brain systems. It is considered a prime candidate for treatment development in a subgroup of children defined by robust heritable biomarker. Vitamin D and its hormone equivalent that vitamin D gets turned into, called calcitriol, activates the transcription of serotonin synthesizing genes that are associated with autism. This serotonic system is involved in various functions in the central nervous system and the gastrointestinal tract. The patients with gastrointestinal problems often have associated psychiatric diagnosis as well. And evidence suggests that serotonin plays a critical role in these conditions. Vitamin E deficiency during pregnancy and early childhood has been linked to autism spectrum disorder, and studies have shown that vitamin D supplementation can improve symptoms, but the mechanism is still not clear. Further research is needed to understand the relationship with vitamin D and autism. So you can't just take vitamin D and expect it to get rid of your autism triggers if you have autism. And as a mother, as an expecting mother, or as a prospective mother, you want to get pregnant, just make sure you have a proper amount of vitamin D in your system. You can get it from walking out and getting sun, but during the winter, right now, you're going to get less vitamin D. So you always can take a vitamin D supplement. Talk to your doctor about the proper doses, but the RDA is 400 IU, but some doctors are suggesting to take upwards of 1,000 IU or even higher. It was once thought to be toxic to the liver, kind of like vitamin A overdoses, but they're finding that it's not as toxic to the liver as they once thought. So I don't know of anybody who's actually overdosed on vitamin D, but just check, moderation. Make sure that you get enough vitamin D. It's not like a drug. You're not going to get a drug response from vitamin D. If you take 400, you're going to get what what you're supposed to get throughout the day. But if you take 1,000 or more, it may help a little bit better, because sometimes people can't absorb vitamin D as well as they should if they have gallbladder problems or problems digesting oils. And so just check with your doctor and get the suggested amount that would be proper for you. And if you have autism, you can look into it. These articles, I haven't found they haven't found out a proper dose. So just make sure that you get enough vitamin D. So what happens when you get abnormally high levels of serotonin in your blood? It's also known as serotonin toxicity or serotonin syndrome, and can have severe effects on your central nervous system and lead to symptoms such as agitation, confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, seizures, loss of consciousness, coordination problems. So I can see right there agitation. A lot of us, when we get triggered, we're agitated before we even get triggered by somebody asking us to do something that we don't normally do. Confusion, a lot of us get confused. Rapid heartbeat, a lot of the times that can happen when somebody has a lot of anxiety. High blood pressure, that's associated with anxiety. Dilated pupils, that's also anxiety. And muscle rigidity, that a lot of people with autism have are uncoordinated. They have problems with coordination of their muscles. Seizures, I'm not familiar with that as far as a thing that's common with autism. Loss of consciousness, probably not. I'm not sure about that. And then coordination problems. Serotonin syndrome is often caused by the interaction between two or more drugs that increase serotonin levels. So be careful if you're mixing antidepressants, pain medication, and or dietary supplements. So if you're taking something that increases your serotonin, and then you take a dietary supplement that's supposed to help with anxiety, that could be raising your serotonin levels as well. So be careful that you don't double up on it, because you can be doing more harm than good, and you can throw yourself from if you can throw yourself off. And so, abnormally high amounts of serotonin in the gastrointestinal tract can lead to a condition known as serotonin syndrome as well. Serotonin syndrome causes a variety of symptoms in your gastrointestinal tract, including abdominal cramping, diarrhea, nausea, and vomiting. This occurs because serotonin regulates the contraction and relaxation of the smooth muscles in the gut. Elevated levels can cause a hyperstimulation of the gut, leading to those symptoms. Additionally, high levels of serotonin in the gut can impair gut, what they call motility, which is moving of food through the gut tract, through your gastrointestinal tract, and allowing it to digest properly. Like I said, if it's too slow, you're going to get constipation. If it's too fast, you're getting diarrhea. And I'm sure neither one of them is fun. I've experienced both, and I don't enjoy it, and I don't think anybody does. So, low levels of serotonin in the brain, in which a lot of the problem is that if you have abnormally high amounts of serotonin in the blood, there's an indication that the blood-brain barrier isn't working properly enough to move that serotonin from the gut production into the brain, and they're not exactly sure how as to why. But low levels in the brain can result in various symptoms and conditions, including depression, anxiety, sleep problems, and irritability. A lot of times, we can have depression, we can have anxiety, we can have sleep problems, and definitely irritability. Other symptoms can include decreased appetite, decreased sex drive, and reduced concentration ability. So, if you're having problems with your gut and also concentrating, you could have problems with your serotonin system. And it is important to know that low serotonin levels are just one factor contributing to the symptoms. And the causes of low serotonin can vary, ranging from genetic factors to environmental influences. Treatment for low serotonin often involves using antidepressant medications and or other therapies. But one of the side effects of antidepressants is that if they're raising your serotonin levels and you have problems with serotonin not getting to your brain, most of your serotonin is being produced in the gut. So you can get gut side effects from low serotonin. So several ways to increase serotonin levels in the brain naturally are exercise, bright light exposure, healthy diet, sleep, and reducing your stress levels by practicing stress management techniques such as meditation, yoga, or deep breathing. Supplements, one popular one is called 5-HTP. It's a broken down version of the amino acid called tryptophan. So it's supposed to more easily turn into serotonin. But also, if you're having too much serotonin in your blood, if you're having too much serotonin in your gut, you may be getting these side effects. And so it's hard to target if you have a genetic cause or some sort of chemical or biomechanical problem about transferring serotonin into your brain, then there's other things that you're going to have to look into. It's important to remember these remedies may not work for everyone. Regular physical activity can release serotonin, and so it also works to increase blood flow to the brain and stimulates nerve fibers that produce serotonin. Bright light works with stimulating the photoreceptors in your eyes, which can help produce serotonin. And since your eyes are closer to your brain, maybe it'll help increase the brain serotonin, but I don't have any science behind that one. I'm just guessing. Consuming foods rich in tryptophan, the amino acid that's the precursor to serotonin. Foods high in tryptophan are turkey, eggs, dairy products, soy products, nuts, and seeds. Eating enough, making sure that now one of the things that how your body produces serotonin is by the carbohydrates that you eat. One of the problems is you might be producing a bunch of serotonin, but you also may get too much insulin being produced, and then all of a sudden you get a sugar rush and a sugar crash. And then all of a sudden somebody's trying to fix themselves by dealing with their serotonin when they're having a crash due to their insulin. So there's a lot of symptoms and a lot of systems that are being in place. So roughly 25% of autistic children are affected by having too much serotonin in their blood and it not getting to where it needs to go. So that's one of the keys. And they talk about that vitamin D definitely helps with helping produce helping produce serotonin by this system called the arginine vasopressin receptor. So that helps produce peptide hormones like oxytocin and vasopressin, and they also help balance out your serotonin levels. And then also 5-HTP and serotonin. 5-HTP can definitely help as long as you have the right enzymes. It can help with that. So with that, I'm going to post a bunch of links to a bunch of science articles. So I hope you enjoyed this, and please click, subscribe, let people know if you find this enjoyable or educational. Please let me know in the comments if you have any suggestions as to what I can do better. That would make this more exciting and more valuable to you. Let me know in the comments below. Just keep it respectful, and I'll get right back to you. Thank you. This is Dan, and you have been watching Finding Your Hidden Superpower, Autism, Asperger's, and those of us who are neurodiverse, how we can help ourselves to find the best version of ourselves and build the best life we can build. Have a great day.